The U.S. Food and Drug Administration on Tuesday authorized a second COVID-19 booster dose for adults aged 50 and older, amid concerns about the highly contagious and newly predominant BA.2 Omicron variant, which has driven new spikes in cases in other countries. The agency said the new boosters, a fourth round of shots of the Pfizer-BioNTech and Moderna vaccines, should be administered at least 4 months after the previous dose. Dr. Peter Hotez, professor of pediatrics and molecular virology at Baylor College of Medicine, says another booster could be critical for protection.
We have data now from the Centers for Disease Control showing that after a few months out of your first booster, you have a decline in effectiveness to around 66% protection against emergency room visits, 78% versus hospitalizations. In addition to that, we have data coming out of Israel now saying that if you get that second booster, the fourth dose, it tends to restore it to that previous effectiveness.
Scientists and officials have debated for months if and when an additional booster shot would be needed, as they parsed data on how long protection from the vaccines and boosters would last. COVID cases in the United States have dropped sharply since a record surge in January, but have seen a small uptick over the past week, according to data from the U.S. Centers for Disease Control and Prevention. The U.S. National Public Health Agency said on Tuesday that the BA.2 subvariant of Omicron was estimated to account for more than half the coronavirus variants in the country. A resurgence of COVID-19 cases in parts of Asia and Europe has raised concerns that another wave could follow in the United States, but the country's health experts believe it is unlikely. A top official said on Tuesday that the U.S. Food and Drug Administration will weigh the benefits of authorizing another round of boosters of either the Pfizer-BioNTech or Moderna COVID-19 vaccine to a broader population in the fall.